It is 11 o'clock, and thank you everybody for joining us. And here is Janice Gilly, our County Administrator.
Well, thank you. Thank you for taking the time to join us on such short notice today. This is our opportunity to share with you information about public health and safety here at the county. And I wanted to first start by saying we do have our Mask Up campaign going, and we are asking folks to, follow the CDC guidelines and, do their best to mask up when in public, when they can't socially distance, and then, avoid the closed spaces or crowded places and close contact with folks that they might not be able to socially distance or physically distance from. Today, we're going to introduce Jason Rogers. He's been at our meetings. I think he's been here 3 whole weeks now. This will be his first opportunity to present in a team setting and to answer some of your questions that you may have about public safety. And Jason comes to us with 27 years of experience as a paramedic, a police officer, and also an executive director of emergency management. And he sat on the fire board in Indiana and managed professional standards and things like that. And then after Jason gives us an update, we're going to have Eric Gilmore walk through the dashboard to make sure that we answer questions that folks may have about the dashboard. They are continuing to try and make some improvements to that, make sure that we are answering your questions that you have specifically related to Escambia County the best that we can. And then we will end with Chief Powell. He will give you all an update on the jail, the work annex, our inmates over in Walton County as well. And then I will wrap it up, and then we'll let Laura come back in and let you all ask questions. So Jason, why don't we kick it off to you?
Thank you, Madam Administrator. I just want to give everybody a kind of a brief on where we're at in public safety with regard to all of our divisions. We are maintaining services. We're staying vigilant to make sure that we are providing the absolute best public safety that we possibly can. We have made a couple of changes. And we're partnering not only with people who we have mutual aid agreements with, but certainly each other between 911, emergency management, fire rescue, EMS, and the lifeguards. So, we're trying to pull all the pieces together and get through this COVID-19 pandemic together is certainly the message that I am putting out to all of our department heads, and so far so good. I'm very happy about that. Also, with regard to EMS, there's been some questions, so I want to clear up some maybe misinformation or information that is a little cloudy. On a regular day that everybody comes to work, we run 18 ambulances during our peak times. We have not reached a critical stage, and I've heard that used, that term used as critical stage, and we are not there. Our minimum staffing years past was 10 ambulances, and that's what we would run on a regular basis. So I spoke with Chief Madry and said, I don't want to have an emergency situation where we're at 10 and suddenly we're at 9 and 8 because of COVID-19. So we are leaning very far forward and have instituted our mutual aid plan. This is very much like a hurricane response. So a few phone calls, and we have staffing far beyond where we would need to be, which is great. So a couple of things that we've done with EMS is we've reached out to Brett Jovanovich. I want to say thank you to him from GMR, and the team at Lifeguard, Ed and Dwayne, have been absolutely fantastic. It was just a couple of phone calls, and they are supplementing us for the next 3 days. So for us to be critical, I would consider that at 10 or below. We were at 15, and I want to make sure that our partnerships are well in place, that we have communication both up and down the line, and make sure that we are working seamlessly if we do reach the situation where we are very concerned. Certainly, we can't tell you what's going to happen day to day, so we want to lean very, very far forward. So today and throughout the weekend, we have 15 ambulances of our own, a quick response vehicle of our own, and we are supplanting them with 2 of the Lifeguard ambulances. So we're running 17 ambulances plus a QRV today during our peak hours. That is as close to everybody coming to work and life being normal as possible as we can possibly get. Same for Saturday, same for Sunday. So our peak hours, we're running 17 units plus a quick response vehicle when we can fill that in. So we are going to have plenty of staffing. Our off-peak hours, we're still well above what we would normally have, and I feel confident if we need to change those hours, certainly with the team between Ed and Dwayne at Lifeguard, we're going to be flexible. I want to have these conversations far in advance before we ever run into a situation where we run out of ambulances. Response times are concerning, and I'm watching those very, very closely and working with our team at 911 and Andy and his crew to make sure that we are using priority dispatch in a fashion that benefits the public, as well as appropriate resourcing. So those are the things that we're working with. Of course, Eric has done a fantastic job with the dashboard and managing the mountains of information that we are gaining every day. So, just to put it into perspective, to understand where we're at in public safety, we have 576 employees, and I'll speak about EMS specifically. We are awaiting test results on 5. We know that we have 9 positives, and we've isolated of all those 21 individuals. So we still have 130-ish employees that we are operating with. The other thing is I have asked the administration to in EMS to excel our people who are in orientation, so we get them back out into the employee pool and we can get them started as quickly as possible. We have hired some people that have experience. It's not their first day on the job, and we want to maximize our ability to respond to those emergencies. So I will turn it over to Eric to talk about the dashboard and what emergency management is doing to help us, respond appropriately.
Thank you, Jason. So I'm going to talk to you guys about the dashboard, and in doing so, I'm going to share my screen so we can pull the dashboard up and look at it together. But before I get started, I'd like to give kudos to David Myers and Travis Tompkins. My two, Travis Tompkins works for me, David Myers with IT. Big thanks for them helping me out and getting the information and pull it into a dashboard. This was as a directive from the Board of County Commissioners that they wanted to see an Escambia County snapshot and the information to put out there for bed availability, ICU beds. So the residents could go out there to this dashboard and see what's happening in Escambia County for this day. Knowing that, all the pieces of data that are on this board are already out there. They were just scattered on ACA, DOH's board, City of Pensacola's board. And what we've done, all we've done is go out there and get the pieces of information and compile them to the one dashboard. So I'm going to show the dashboard now and go through each section. If anybody has any questions toward the end, of course, we'll be able to answer those questions. We try to just, like I said, consolidate. So we have, of course, our total cases, which includes our non-residents. And the dashboard's interactive. It does have tabs at the bottom, and it's got scrolling arrows. So the tabs are there because when we have the scrolling arrows, we've got too much information for the tabs to be in place. So that's why you have scrolling arrows versus the tabs. So you can tab through each one so as you can see the Escambia residents' total cases, and then the non-residents broke out as well. So that's just simple information right there. We have our daily, our cumulative residential deaths, and you can scroll over and see that charted as far as non-residential, and then the monthly, where we had our peaks in our months. I think we've had no more than 4 in one day during any given period, and that's what that chart there will reflect from April, May, and June. So you can scroll through those. We also have our total tested, so we're pulling that off the dashboard, DOH's dashboard, 40,774 total tests done, which includes non-residents, and then we have our residents that tested negative. Those are just numbers that are posted up there, and they'll get pulled off daily and updated. On our cases per day, we have it done from June 26th through July 6th, and you can see we've averaging, a little over 100 cases per day. And as we scroll through, you can see the median age. You can get your demographics information by scrolling through this section, cases by age, cases by gender, cases by race, cases by ethnicity. So there's a lot more information in that category that you can glean from that. This is where everybody has a lot of questions. So our total COVID hospitalizations, where are we getting this number from? This is actually reported to us from the hospitals. So I know DOH's dashboard shows today 170 hospitalizations. I've asked DOH, and I haven't got an answer back yet, and I'm hoping to get the information back. Right now they're showing 170, and my question to them is that and that's supposed to be their cumulative number. We're showing 137 today in our hospital system. That is West Florida Sacred Heart and Baptist Hospital graciously giving us that information daily so we can update that number. Yesterday, it was 142. So as you can see today, we've had a drop in 5 cases. It's 130 or 5 beds. We've got 137 in the hospital today. So we went from 142 yesterday. And a lot of questions yesterday was it seemed like it was just steadily increasing. So that was the concern that a lot of media and the public had is that just a cumulative number? No, that's a real-time number. That's as of today. Now, understanding that when we grab that number out there, in the next 30 minutes, somebody can be discharged from a hospital or somebody can be intake. So that number can fluctuate throughout the day. That's just as of what the hospitals reported to us for today's data. So then you can also click on the daily hospitalizations. That'll give you a chart. And as you saw, we've been on a steady incline, and that's why everybody had that confusion. Is that cumulative? And no, it's not. It's supposed to be a real reflection of how many are in our hospital system today. Now, that does take in consideration of all hospitalizations. So it's not just Escambia residents. We are a regional hospital system, and we know that. And the hospitals consider if a bed's taken, a bed's taken. So it doesn't matter where they're from. That's how many they have in the hospital right now that are COVID patients. As I said, the 170, I'm asked DOH to tell me, is that just Escambia County? How did they break that out? I'm trying to get more information on that because that's their rolling total, but that is supposed to be represented real time, reported by the hospitals to us. So that's where we get that number from. Then we get our hospital bed availability and our ICU bed availability straight off the AHCA dashboard. There's a AHCA PDF page that you have to go out and dig through AHCA site. And they through ESS, the emergency status system, the hospital's reporting to that daily. So you can see cumulatively or for Pensacola or for Escambia County, how many total beds are available today. And then you can break it down by hospital by scrolling through the tab at the bottom. Same with ICU beds. You can see total. We have 8 ICU beds available, adult ICU beds available in Escambia County, and then which hospitals have the beds availability for the beds. But also note that a regular bed can be converted to an ICU bed. Our hospitals do have surge capacity. I have asked them if we could break down COVID patients in ICU beds, and that's not some data points that they want to give because at the end of the day, if they need to make ICU beds available, they can make them available by taking a regular bed and putting the equipment around it to make it available. So it wasn't that important to those guys to do that. So, but we do give you the right now, real time or today snapshot of how many COVID patients are in the hospitals. Then we have at the bottom left corner our current positivity rate. That is on a weekly. That is a weekly basis, which depicts on our chart just to the right of it. So you can see the weekly positivity rate and the flow, the diagramming of that, how it goes up. And then also we have our testing per week, how many tests we do in a week. And as you can see, we've done 6,500 tests in the last week, a little over. UWF and those guys have been banging it out. Sacred Heart, Community Health, Department of Health, Baptist, they've been increasing their testing capacity. Justin with Sacred Heart doing the drive-through testing, we have exponentially increased our testing in the community. So UWF was only doing 250 a week or a day, and now they've gone to over 750 a day. So they're really banging it out. And not only that, last week we had a new state-sponsored testing site pop up in front of Publix. It was a joint effort with state and Publix out in front of Publix on 9th Avenue for a 18 or over, no appointment necessary, walk up between hours of 9 and 5. So we have 7 testing locations that you can go get tested at. So that's the dashboard. We was hoping just to capture some of that stuff. So it was confusing. It was all over the place and scattered. We've tried to compile it and put it in one spot. So anybody can go in there and check it out and see what's going on. None of this stuff is automatically populated by other dashboards and what the state's reporting and AHCA and the hospitals. And that's the dashboard. So.
Thanks, Eric. Chief Powell.
Yes, ma'am. Thank you. Before I get started with some stats, what I'd like to do is take a little bit of liberty here and just thank all of the correctional staff that are working through this pandemic and dealing with a situation that none of us could have remotely imagined, let alone prepared for completely. But however, thank God we had plans in place that would allow us to manage through this process. As of this morning, we've tested a total of 162 inmates locally. 83 of them currently are positive, 18 are negative, and we have 61 pending. The inmate population that's being held by Walton County, that's 156 inmates total. So far, we have a positive count of our population within their jails at 30. The great thing is that no inmates are presenting any medical concerns at this time, other than being affected with the positive COVID-19 results. As of yesterday, we had a shift in operations at the work annex. Many people know it as the road prison or road camp. Some of the services that we provide inmate labor, because we were able to identify a crew that was coming off of work. One of the inmates had an elevated temperature, and we were able to catch that as before they entered back into a controlled environment of their housing. The individual did test positive. So we've had one positive there, with 2 other tests pending out of there. But as a result of that, with the labor force that we provide to the county, throughout many departments such as roads, grounds maintenance, community landfill, the services that we provide will be diminished for a period of at least 14 days as we stand here right now. So those inmate labor pools will not be going to work as we monitor them for any other signs of symptoms that may present themselves. Again, none of them have presented. We caught this one because of the protocols that we had in place of taking their temperatures. And he did present with a low-grade fever, and we tested him, and he came up positive, and he's being monitored for through this transition period or observation period as well. But in a nutshell, that's it. The biggest thing is that we continue to elevate our cleanliness, and now we're in our observation stage of just observing the inmates, looking for additional medical concerns that may present. And now that we're a couple weeks into this, or a week solid into this, I should say, of having an affected inmate, we still have nobody that is anything other than asymptomatic as we stand here right now.
Okay. Well, thank you, Chief Powell. And then just to kind of follow up to what Chief Powell said, from the standpoint of what the inmate labor provides us, we are going to have to, we will be putting out a press release a little bit later to let folks know we are going to have to close our drop-off sites, the recycling drop-off sites, and other sites due to illegal dumping, which is not uncommon, but that our inmate labor does help us manage. And so because we will not have that for the next couple of weeks, we're going to have to remove those roll-offs and things like that. So we will provide that information later in a press release. I did just want to also mention, every time I get an opportunity to speak, I always talk about the wonderful employees that we have at the county. These employees, we're going on the 5th month of this pandemic. And for the most part, unless they were a vulnerable employee or they had other, health issues, or they had tested positive or been quarantined, our employees have continued to work every single day because they're essential, critical. And that's what they took on this role of public service to do. And so I can't ever give them enough thanks and credit for what they do, but I do appreciate them. And I just want to make sure that I always take the opportunity to say that. Some folks have had a chance to work from home and things like that. And as you can see, our corrections, our public safety, our roads, our parks, our animal shelter, and even development services and building inspections and things like that, they've not had time off. They've continued to work hard and provide those services. And part of those services are part of what the normalcy is that I think our community is so desperately in need of, because there's a lot going on right now that we can't explain. And every day we get a different curveball thrown at us. But we are doing everything we can to manage those curveballs, but continue to provide those services that are paid for by the taxpayers and are expected by the taxpayers. So given that, I'd just like to open it up for questions.
Okay, Janice, this is Laura, and we have a question that Andrew McKay typed into our chat. So if any other media outlets have questions, please do type it in, and we'll go from there. So his question is, Chief Powell, can you also talk about the correction officers' positive tests and confirm that none of the correction officers are symptomatic either?
Yes, as of this morning, we are managing a positive rate of 23 positive staff, not necessarily just correctional officers, but administrative staff as well, and 35 additional pending results. And the second part of that question was, again, could you mind repeating it?
It is, can you confirm that none of the correction officers are symptomatic either?
That's a true statement. We don't have anybody who has reported that they are seeking any additional medical care other than they're at home waiting for the process to run its course. We had a uniqueness with one in particular individual that they had to be tested a couple times before they were negative. But however, they've since returned to work. They got negative results and they returned to work. That was a little bit different. A lot of our staff are not necessarily they're co-located. Somebody in their home has been tested positive, so they're out because of that. We're seeing a lot of that. That a spouse or sibling or somebody that they're living with has tested positive, so they have to go get tested themselves. Not necessarily that they obviously didn't get it at work if they're concerned about somebody who's living with them that's already positive. So they're tracking that right now as well.
Okay, thank you. And the next question is from Commissioner Bender, and then we'll go to Rick and then to Jim. So Commissioner Bender would like Eric to clarify about the 137 hospitalized patients that's not by county. So if you can talk a little bit about that, and then also about why that number varies so much from the state number.
So the 137 is not county specific. That's correct. They're from Baldwin County, Escambia County, Alabama, Santa Rosa, Okaloosa. The hospitals, it's a representation of what's available in our hospital system right now. And we are a regional system. So we count everybody that's in the hospital, not just Escambia County residents. So that number that you see that'll be daily is going to be a reflection of just a COVID positive patient in that facility. So that's the way we'll track it. As far as the DOH number, the 170 that they're reporting today, as I said, I'm trying to get clarification of how they captured that number. Until we started doing this dashboard, we never really questioned that number. So we've got the same questions you do, Commissioner, and I've got the questions posed to DOH, and I'm waiting for them to get back to me. I talked to somebody and they didn't quite know themselves. So I'm waiting on the feedback that they're going to give me. Is it just Escambia County residents that they're counting? It's supposed to be cumulative. Is it truly cumulative? How are they acquiring that number? Where are they getting that number? Because we couldn't find any data points anywhere where you could capture that number. So that was one of the questions we had. So we're trying to find that out, and I'll be happy to follow up and let you know what DOH says.
Okay, and then the next question is for Administrator Gilly. This is from Rick Outson with InWeekly.
Mm-hmm.
Why have you not made face coverings mandatory for county employees?
Mm-hmm. So what we've done is we've asked county employees when they can't physically distance from others to make sure that they protect themselves. No, we've not mandated it, but I have, most of our employees do have offices in which they can work, which means they are segregated from the other employees. And then those that do ride in vehicles together, we are making sure that they wear a face mask if they are in a closed confined space. We've also asked all of our employees, for example, like this, to try and do as many meetings as they can on Teams. And so we're doing our best to make sure that we follow those three C's in terms of, avoid the closed spaces, make sure that if you can't physically distance, that you are protecting yourself. And quite frankly, we have had numerous employees share with us that it is very difficult to wear a mask. And there are physical reasons why people have difficulty wearing masks. And so we are doing our best to make sure that we are being very respectful of each other's distance and space. And so that's why it hasn't been mandated. But I know that we have a lot of employees that are very conscious of their situation and the others around them, and they are trying to be very respectful and make sure that they are protecting them.
Okay, I'm going to get to Jim's question after. We've got a question from Commissioner Burgash. He wants to ask about the recovered number. When will that be added? And there are other entities that use the 6 week after diagnosis as the benchmark. If they haven't died within 6 weeks, the assumption is made that the infection is resolved.
No, absolutely. So we can make those assumptions. Matter of fact, you can make the assumption that, 14 days previous to this, all positive patients who have not died have recovered. So believe me, on the statewide calls, emergency managers statewide are asking for that number because they're hearing it from their county commissioners. So we have asked DOH. We're pushing back. We're hoping that DOH is hearing us and that they'll come up with some kind of measure, whatever it be, the 6 weeks that they're using in other states, and come up with a recovered rate. So we have asked that. It is DOH's information. We can do our own speculations if we want to, but it is DOH's information, and we have pushed back, and we're waiting on a response. So we haven't heard anything officially yet, but yes, we're waiting on that. Believe me, statewide, we've all asked that. So yes.
Okay. The next question is from Jim Little with the Pensacola News Journal. It's for Chief Powell. Can you go into more detail about what is being done to prevent the spread of the virus in the jail and road camp? Are masks required for inmates or correction officers?
No masks have been mandated. It's highly encouraged on our staff, and the majority, if not all, are participating in the same thing with the inmate population. The expectation is if they're transported out of their housing unit, that they'll put a mask on. And if there's an issue with them refusing to put a mask on, then we will bring in services to them. But again, we've had absolutely no issues with inmates desiring, or should I say, refusing to put a mask on if they got to go to sick call or something like that. They've all complied. We've not had to manage it any other way.
Okay. The next question is for Jason Rogers. This is from Rebecca Castor at Channel 3. You spoke about the partnerships the county made to ensure there are more than enough ambulances for today and through the weekend. Why was there concern that there might not have been enough ambulances this weekend?
Oh, you're on mute.
You're on mute.
I'm sorry. It really wasn't the fact that we were concerned that there wouldn't be enough this weekend. For one, I didn't want to get to the point where I was making the phone call in haste. So as we started to see the uptick in positive cases and people that we were isolating, and that number started to grow. I wanted to get these partnerships in place before it was an emergency. So we are enacting these things, and we're going to continue. It's an ebb and flow, whether or not we've got employees that are going to test positive, whether or not, I've got several that are kind of ending in the isolation stage. And those that are working have maybe been exposed to positive patients. So we don't think that this is going to end anytime soon. So I want to stand very close to the point where we are fully staffed every day. So these are efforts to make sure that our partnerships are working. These other agencies have responsibilities that they have to deal with, and they've got sick people out too. This isn't just us. This is not certainly the Panhandle or the central part of where we're at in the United States. This is the entire country. So I have talked to my counterparts in Texas and of course Indianapolis and New York City, and how are they dealing with those things? And so I want to have us leaning as far forward as possible. So the fact that it just fell in the last 24 hours that we're enacting these things, we're having these conversations. It wasn't for any other reason that we want to lean very, very far forward and make sure that we don't get into a situation where someone calls 911 and we're not available to respond. And so it wasn't that this weekend was a hot spot. It was more that we want to make sure that we have those resources in place.
Okay, there's another question for you, Jason. This is from Andrew McKay at News Radio. I thought you initially mentioned being concerned about dispatch or response times. Is that because there has been a drop-off, or did you just mean you are paying close attention to that?
No, I'm paying very, very close attention to it. So when we started to see the pandemic affect healthcare, we saw about a 30% drop nationwide in 911 usage. As we have, learned more about the virus publicly, we're starting to see those people that would have normally called 911 to call again for an ambulance for, non-COVID related. So I want to make sure that we have our fingers on the pulse of when those are. And I think I need to state also, with regard to dispatch, I went to our dispatch chief and said, when are our peak times? And that's when we have implemented the partnerships. So our peak times are from 9 a.m. to 9 p.m., and that's when we are bringing in our mutual aid trucks. So it's not 24 hours a day. And so, we just want to make sure that during those peak times, historically, several years, this is the data that we've looked at, and that's what I'm being informed is the best time to implement this.
Okay, and this question that Rebecca just submitted relates to this topic, so I'm going to jump down to hers as well. This is Rebecca from Channel 3. Can you restate the agencies the county has partnered with to provide the additional ambulances?
Sure. Right now, we have 2 lifeguard units that will be in our peak times. They are placed right into our system, so it's just as if it's one of our trucks being dispatched. It'll be the lifeguard system from Santa Rosa, and I went through the parent company, GMR, which is Global Medical Response, the company that owns AMR. And so, working with their leadership to make sure that we have all the pieces in place. Right now, because the state medical director has relaxed some of the requirements, we can also, if we have to get help in from Alabama, we can certainly do that. That's why we're partnering with GMR, because they are a large parent company for many ambulance services. So it may not just be lifeguard, it could be somebody else that if and when those needs arise, that they will be met very, very quickly.
And Jason, this is part of our plan, correct? This is part of the
Absolutely.
plan.
This is 100% the plan that we would have in place for hurricane response. And, this is disaster planning. We do all hazards planning. So just because it happens to be titled COVID, doesn't really affect how that we are going to operate things. And that is how emergency management is planned all over the world.
Okay. The next question, there's a few for Administrator Gilley. This is from Rick Austin within Weekly. The commissioners have asked you to set up testing for employees at either the county clinic or the jail infirmary. Have you done it? If the answer is no, why not?
Mm-hmm. So the clinic is an independent contract, and so we'll have to continue to work with them. And then as far as the jail, I'm not aware that anyone has been denied any testing that has requested testing. What we hear from epidemiologists is if you have not been contact traced, or if you've not come in contact, been directly contacted with this particular virus, testing will not necessarily be helpful. Because you may be, for lack of a better term, wasting a test. So what we're trying to do really is make sure that folks that are taking tests have had some kind of contact, either whether it be a family member or maybe it's a suite mate or something like that. So we have not prohibited anyone from going and being tested or had the opportunity to test. And we have not discouraged folks from being tested. So our employees are eligible to go get tested. As you know, whenever we had the ECAT situation, we were able to work with DOH and have them come out and set up, and I believe they did 81 tests at our ECAT, which included not just the ECAT employees, but other employees. The good news is all of those came back negative. One was inconclusive, and I know that person has subsequently been retested by a different entity. So we've not discouraged anyone. What we are trying to be cognizant of is that if someone has been contact traced, they do go and get tested.
Okay, and he has another question. Mm-hmm. The current COVID outbreak appears to have begun around June 24th. How many county employees have been tested since June 24th?
Mm-hmm. So being tested is a private matter. And if they are testing and telling their employer, we do have it recorded. They are not necessarily being tested, through FDOH or the state or things like that. And so we are asking them to report and tell us when they're tested. I have not had a rolling number of those. What we've tried to do is we've tried to manage daily the number of employees that may be out or isolated due to testing. So I don't have a cumulative number.
This next question is from Jim Little with the Pensacola News Journal. This question is for any commissioner on the call or Administrator Gilly. The Pensacola City Council will be voting on a resolution calling on the county to implement a mask requirement similar to the city's. Is there any thought to consider that?
I don't vote, so it'd probably not be for me to respond to. There are, I know there's at least one commissioner on here because they put a question on, but I would think that would be there.
I'm here. I'll answer it. Can you hear me? Can you hear me?
Yes.
Oh, yes, sir.
Can anyone? Okay, this is Commissioner Burgash. I'll certainly look at whatever they send over. But my answer to that question is I believe we have taken the prudent choice, not the knee-jerk choice. And that is we educate and inform everyone, and we provide masks to those who want it. And those who are medically fragile, infirm, or at great risk have the ability to make choices to limit their exposure, while at the same time, everyone else, all the rest of us, can go about our lives while practicing the CDC guidelines. For my one vote, I think that's the prudent course, and I think the city made well, I'm just going to leave it there. I think that's the prudent course.
Okay. Are there any other commissioners that would like to comment? Okay. Well, we'll move on to the next question. This question is again for Ms. Gilly. This is from Rick with In Weekly. The county is spending $250,000 to encourage residents to wear masks. How well will the campaign work if citizens go into county facilities and see county staff not wearing masks?
So I'm not completely convinced that they're going to go in there and not see employees wearing masks. But I also know that we have put where we have the citizens coming in to meet with our employees, we've put up these what I would say plexiglass barriers. So we've already put shields up in those places to try and protect those employees when they're dealing with the actual citizens that come in. So yes, we've encouraged masks, and we've encouraged folks to do what we said and avoid those 3 C's. And, you know, I think the education piece of this is one of our main issues that we're trying to get across. And if you're not comfortable, you know, we would definitely make sure that we provide other ways for that for the citizens to be able to work with our employees. But for the most part, we've already tried to put safeguards in place so that when the citizens come in, they already have some safeguards to work with employees. And as one of the commissioners mentioned, we have provided masks at all of our libraries, our community centers. Eric is, you know, trying to do his best to keep up with PPE and make sure that we have those available even at lifeguard stands and at Stefani Road, you know, extension service. So I do think that education is the key, and we're trying our best to be part of that education.
Okay, I see one last question, and then as a reminder, we will be posting this virtual press conference on our social media channels on YouTube and on our emergency management Facebook page for the public to see. This is the last question from Rick Outzen for Jason. Would wearing face masks be considered leaning forward?
Well, I think I can only speak for public safety because that is I guess I need some context. Do you mean in general with the public, or do you mean the public safety crews that we're talking with? So I'll speak to the public safety crews. I would consider that to be yes, because we're worried about their health, safety, and welfare. So we have instituted mandatory, if you leave the fire station, you should be in a mask. If you go on a call, you should be in a mask. EMS the same way. If you're riding in the vehicle, you should have your mask on. Same with the lifeguards. If they're not able to social distance at a lifeguard stand, and we have 2 lifeguards that are inside the stand, they're supposed to be in their masks. If they can be 2 arms length away while they are guarding at the station, lifeguard station or lifeguard tower, then it would be appropriate and prudent to social distance, and that's okay not to wear a mask. So I think the fact leaning forward is maybe a little subjective, but that is what we are trying to do in a holistic way with our entire plan.
Okay. Janice, would you like to share some final thoughts?
No, like I said, I thank everyone for taking the time to join us. I know everyone's just as interested in information, and we try every day to provide a daily update that, we are providing as much information as we have, whether it be about the dashboard or it be about our employees. I mean, the information that we are providing about our employees, quite frankly, was a management tool for myself and the directors to be able to make sure that we were staffed properly. We're happy to share that with the public, but I also want to make sure that everyone understands that we are dealing with these curveballs and dealing with this pandemic as it comes up and changes daily. And so, into our 5th month of it, we're not perfect, but I would say that we are doing our best to manage everything that comes our way better each day. And so I just thank everybody for taking the time. And like I said again, if you know a county employee, thank them for the job they're doing and for the services they're continuing to provide.
Hey, Janice, before we end this thing, I'd like to clarify one thing, if that's okay.
Yes, sir. Yes, sir.
Yeah, this is Commissioner Burgash again. Again, I just want to reiterate what I said and just kind of so there's no ambiguity. I do support the CDC guidelines. Where I work during the week, I have to follow the policy and I wear the masks. And I've got multiple in my car, got them in my office. And I strongly support the ad campaign that the county has put out. And I'm encouraged by the fact that we're providing the PPE. I just want to make sure everyone understands with crystal clarity my individual position. It is. It's a tough thing to enforce. It's not being enforced in the city. I've been to places in the city. Just this morning, I was at a place in the city. No one was wearing masks. So it's impossible to enforce. And I don't want to criminalize a 25-year-old triathlete, who's out running without a mask. And I just don't think it's the right approach. But I think for those who are concerned, by all means, follow the CDC guidelines, wear the mask. But asking us to mandate it is a different story than us strongly encouraging it, providing it, and encouraging. And I just want to make sure everyone, and add to that fact that the schools are going to reopen, many of which I know as a school board member are within city limits, and they're not going to be wearing masks, made to wear masks. So if it's something that is put out there and not easy to enforce, or worse yet, not enforced, what's the point? It actually becomes more of a problem. That's Jeff Burgash's personal opinion. Just wanted to make sure everyone got that.
Thank you.
Okay, well, that concludes our press conference. And again, we will be posting this online for everybody to view. Thank you for joining us.